When you're in EMS, you're at some point possibly going to be faced with a situation involving a patient who has a service dog. And it is important that you understand how to properly deal with these kinds of situations. First of all, a service dog is a dog that is trained specifically to mitigate a disability. And emotional support alone does not qualify a dog as a service dog. Some tasks that a service dog can do can be guiding a blind person, alerting a deaf person to sounds or danger, doing tasks to bring a person out of a flashback with PTSD. There's other tasks as well there's many different tasks for psychiatric disorders. Alerting a diabetic to low or high blood sugar, and responding to a person having a seizure, or alerting them before a seizure happens. A handler's right to be accompanied by their service dog is protected by federal law under the Americans with Disabilities Act. There's also additional protections in some cases under state law, and this ensures that the handler is allowed to be accompanied by their service dogs in most places. It's important to know that the rights are the handlers and not the dogs. The only place that a service dog can really be excluded is sterile environments, and that would be like burn wards or operating rooms. And it has to be a sterile environment, which means the entire room is sterile, not a sterile field. So in emergency room where, say they're doing a small operation on a hand, which requires a sterile field, the service dog is still allowed to accompany the handler in that room. Basically any room that someone in street clothes can go in, where everyone isn't required to basically be in gowns and masks. And this includes ambulances. Now, when you're faced with a service dog or a potential service dog and you're not sure, there's two questions that you can ask. Is this a service dog? And what tasks is the service dog trained to do? A service dog will not always be identified by a vest or anything of that nature. You also cannot ask for identification. You cannot ask for paperwork or certification. There is no such thing as any of those that has any legal bearing in the United States. Now, when you're interacting with a patient who has a service dog, it's important to not distract the service dog. Don't be petting the service dog. Don't touch the service dog. Don't talk to the service dog. Your job is to focus on the patient. And do not ask questions about the service dog or the person's disability, except as how they pertain to patient care. Within some service dogs' gear or vests, sometimes they will have pockets. They may contain things such as medications, emergency contact information, cell phone, doctor's information, or other emergency instructions. So be aware that those vests can contain that useful information to you as first responders. When you approach a service dog, you need to be aware of the dog's behavior and keep scene safety in mind. Service dogs are trained specifically not to be aggressive. However, every dog has its limits, and if you're in a case such as a bad car accident where the dog has gone through some trauma and may be injured as well, even the most well-trained dog has the potential to be aggressive. So you need to evaluate if the scene is in fact safe for you to go in. And also be aware that a dog just barking may not indicate aggression. For example, a handler who is unresponsive, the dog may be trained to bark for help. It's not barking because it's being aggressive, but it's barking to attract attention, to get the handler the assistance that they need. When it comes to access issues with your ambulance, it's important to understand that even if your agency has a policy about no pets being in the ambulance, this does not pertain to service dogs. Service dogs are legally medical equipment, and the Americans with Disabilities Act supersedes any kind of no pets policy that you would have. and denying access to a person with a service dog is a civil rights violation and can subject you to heavy fines, as well as, depending on your state, it may be a crime that's punishable by fines and imprisonment in some cases. So the first thing, like with any emergency, you want to ensure at the scene safety. And then you also want to assess your patient. After you're sure that your patient is stable, you also need to, if the dog is involved in an accident, find a way for there to be appropriate medical care for the dog, whether animal control has to be contacted or a family member has to be contacted. If the animal is injured, and the handler may be able to make some decisions regarding how the dog should be treated at that point. You do not want to separate the service dog from the handler. A lot of handlers may even refuse to go to the hospital if you insist on separating them from their service dog, which again is a civil rights violation. There may be instances, for example, if someone has an extremely large service dog and you have like a van-type ambulance and they don't have a proper way to secure the dog so that the dog fits and allows you to do your job, in which case it would be a fundamental alteration, and the service dog may not be in the ambulance. The dog may either ride with a family member to the hospital or animal control, or if law enforcement is willing to transport the service animal to the hospital for the handler. If the service animal is going to be transported inside of the ambulance, there's a variety of ways to secure it. There are seat belts, harnesses. The handler may or may not have these pieces of equipment with them. What it boils down to is you need to care for the patient as you would any other patient. They're just bringing their service dog along with them to the hospital. And if the hospital has a problem with it, well, they have a problem with violating the law themselves. Service dog can only be excluded if it shows a direct threat to others or it is not housebroken. Also be familiar with your region's protocols. Your state or region may have their own protocols. I know that New York has one specifically for service dogs, so make sure that this is included and that members of your agency are familiar with it.